Hello and welcome back to GP Video Podcast by Nadia. So, today the topic that I'm going to start is called menorrhagia or heavy menstrual bleeding. We encountered this problem a lot in the general practice with women because 1 in every 5 Australian women suffer from heavy menstrual bleeding or menorrhagia. So let's talk about it. Okay, what is heavy menstrual bleeding? Heavy menstrual bleeding, as I said, is also called menorrhagia. On average, women lose 40 ml of blood during one period of menstruation. Excessive menstrual blood loss involves more than an 80 ml loss. Now, how are you going to quantify that? The volume of blood loss is rarely measured in practice. The diagnosis is based on symptoms such as changing pads every 1 to 2 hours, bleeding lasting more than 7 days, and passing large clots. So bleeding lasting more than 7 days, 7 days is the normal maximum normal period that one should bleed. Changing pads every 1 to 2 hours and passing large clots. A diagnosis can be made based on a self-report of very heavy periods. Heavy menstrual periods can have a significant impact on quality of life, as we all know. Not only physically, but emotionally, mentally, it can be really distressing. Now, how can we classify the causes of heavy menstrual bleeding or menorrhagia? Dysfunctional uterine bleeding, which is the diagnosis of exclusion when we do not find any other cause for uterine bleeding, like heavy menstrual bleeding. See, first of all, I would like you to differentiate between heavy menstrual bleeding and irregular uterine bleeding. Like at this stage, I'm only talking about when women are bleeding in their cycle, like then they're having their menstrual bleeding, and that is heavy. I'm talking about that only. I'm not talking about irregular, out of menstrual period cycle bleeding. That is another thing that we will talk about at some other stage. But here I'm talking about when women bleed once a month or once in 28 days. That period lasting more than 7 days. That period, in that period, women passing large clots. In that period, women changing pads every 1 to 2 hours. That is called heavy menstrual bleeding. And at this stage, I'm only touching this topic and only talking about the causes of this kind of bleeding, which is the actual menstrual bleeding. So what are the causes? How can we classify them? First of all, the biggest cause of heavy menstrual bleeding is called dysfunctional uterine bleeding. It is the major cause of heavy menstrual bleeding and impacts on women's health both medically and socially. Dysfunctional uterine bleeding is the diagnosis in 40 to 60% of women with excessive menstrual bleeding, which is defined as greater than 80 ml blood loss. Okay. So, the assessment of heavy menstrual bleeding, as I said, is quite subjective, and 80 ml, 40 ml, of course, we cannot quantify that. And it is possible that women may over or underestimate their menstrual loss. The symptoms and signs that may signify heavy menstrual bleeding include, number 1, an unusual increase in blood loss, more than 7 days of bleeding or flooding not contained within pads or tampons, particularly if wearing the largest size. Number 4, clots greater than 3 centimeters, and the presence of signs of anemia or iron deficiency on blood testing. Because of course, after history taking an examination, a general practitioner would do blood testing, and if that shows iron deficiency, anemia, or just iron deficiency, not necessarily anemia, but the physical signs of anemia, being pale and all, then it is like pathognomonic that yes, the patient is having heavy menstrual bleeding, if she's also complaining of heavy menstrual bleeding as well. So dysfunctional uterine bleeding is a common problem in women in the 30 to 50 years age group, but it can also happen so when in menarche and around perimenopause. As if you would remember, when I was talking about menopause and perimenopause, I said that the periods can either become light or become very heavy. So that is also dysfunctional uterine bleeding. and then menarche, when the menses start, for few years, or maybe like up to 5 to 10 years, women can have, girls can have dysfunctional uterine bleeding. The pathophysiology is not usually understood, and it is complex. This functional uterine bleeding, again, as I said, and I'm emphasizing again and again, is a diagnosis of exclusion. So if it is a diagnosis of exclusion, then what are the other causes that we can categorize? The other causes, apart from dysfunctional uterine bleeding, can be categorized into 4 categories. Number 1, so I was talking about, sorry, there was an interruption. My child had just came in, barged in. Okay, so apart from dysfunctional uterine bleeding, the other 4 categories that are diagnosis of inclusion that we need to exclude to be able to say that the woman is only having dysfunctional uterine bleeding are 4. Number 1, hormonal. Number 2, changes within the uterus or uterine causes. Number 3, blood disorders or medications causing blood disorders. And number 4, other systemic disorders. So number 1, hormonal causes. Number 2, causes within the uterus from where the women bleed. Number 3, bleeding disorders or coagulation disorders, or the medications causing coagulation or bleeding disorders. And number 4, other systemic disorders. So we'll talk about these tomorrow.